Hi everyone, I'm back again with another video, and on today's video I'm going to discuss something about the mental health and a multidisciplinary approach towards it. I have seen a lot of clients coming up to me and they get confused regarding what exactly is the problem with them. They are not able to share what exactly is the pain, where exactly they are feeling the symptoms or the signs since quite a long time, or it's very acute or chronic. But usually they really don't have any kind of origin of pain in their body. Many people suffer from stress, anxiety, fearfulness, the fear of getting to sleep, sleep apnea, sleeplessness. These are some kind of problems that are faced by a mentally unstable person. They might be getting hallucinations, they might be getting some dreams which are bad, and usually they're schizophrenic or they get schizophrenic type of symptoms. But mind you, these are all kinds of some symptoms and signs which are seen in a patient, but they're not acutely a disease, we can say. These are a cluster of things or characteristic features that arise in a person. And because of these mental health issues, physical well-being is also disturbed. People get a lot of other complications related to musculoskeletal disorders, related to neurological disorders, related to cardiovascular, skin problems, eyesight issues, migraine, neck pain, etc. So don't you think this is really a concerned topic which we need to understand why it's happening? Trust me, we are supposed to spread the word of awareness. We need to participate to understand the person, what is exactly his problem. There are a lot of treatment procedures which are there which can help a person who is dealing with all these things can overcome these fear or anxiety and can live a happy and a healthy life. Counseling is one of the most important factor. Education, awareness, knowing the history of the patient is very important. Some people might be having many traumatized history in their childhood or in some part of their life which make them to come to this stage. Mental health issue can occur in both male and female genders, irrespective of who they are, a child or a mother or a working professional, doctor, engineers. It can happen to anybody. So it is really very important for us to understand that the person who is showing such kind of symptoms should be helped, not to be ignored. We as physiotherapists are also a team member who work together with the other medical fraternity or medical uh, departments like counselors, educators, psychiatrists, who can come up with a brilliant protocol that will be helpful for those people who are having mental health imbalances. If a person is having any kind of mental health problems and they have related other issues as I mentioned, they should be prescribed with a customized protocol or a customized treatment plan where it can be started right from their home only. We can tell them to modify their living, that is modification, lifestyle modification can be done. They can start medications under the guidance of their physician, regular exercises. A proper sleep wake cycle should be maintained on a regular basis. Supposedly, if you're going to sleep at 10 o'clock, waking up at 6, you have to maintain that for at least for a month so that it becomes quite habituated to your body. Proper rest between your working hours, going for a walk, getting connected to the nature, communicating, networking with your peers, your friends, your family members, expressing your thoughts, getting consulted by a counselor, getting consulted by a psychiatrist. It's not wrong in consulting a psychiatrist because many people have that norm that it's absolutely bizarre to visit a psychiatrist only if I have any mental problems or if I'm having any trauma in my mind. That's absolutely wrong. Our psychiatrists help us a lot in counseling ourselves, in letting us overcome this fear of stress and anxiety, and they show us a path where we can follow some guidelines, some protocols that will help us to overcome or to come outside this boundary of mental health imbalance. Exercises like active free exercises, movement of every joints, stretching exercises, ball exercises like this gym ball, it's very beneficial because it helps you to feel the happiness like a kid. It gives you that response towards your body where you can lie down, you can sit on it, you can use that a wall slide. There are a lot of gym ball techniques that can be followed by a person who is having such symptoms, that will not only help them to overcome the physical barriers, but also it will help them to soothe their mind as well. They can focus on their body, they can focus on their respiratory system, they can focus on their breathing. Relaxation techniques like deep breathing exercises, various kinds of deep breathing exercises are there: diaphragmatic breathing, inhalation and exhalation through your nose and mouth, pursed lip breathing. Relaxation techniques like meditation, like yoga, doing some pilates moves, and also if somebody likes music or song, you can go for some aerobic moves which will help you to enjoy your favorite song as well as to sweat out, and you try to forget all your problems, all your stress, and you completely get into that song and completely get into your own body. As I mentioned, physical exercises, mentally getting stable by doing meditation, yoga, relaxation techniques. These are all a multidisciplinary approach, and it can be done with the help of physiotherapists, with the help of your physician, with the help of a counselor, educator, who form a team. This team can help you to overcome this barrier, and this mental health word or the topic will not be there in the society. People who are not getting such help can come up to us, write to us, tell us your story about it, how you feel, and what kind of things that you love to do. That is very important. Sharing is very important. Opening up about your thoughts, what you feel, is very important. Do never hesitate to visit your physician or counselor in a fear that you might be having any problem. It's not wrong in visiting a medical team. Get supervision, get supervised by your consulting physician. That is very important. And keeping a balance between your work and professional life, work, professional, and your personal life is very important, because this is this has been shown to be one of the reasons for having such kind of imbalances in a psychological status. So if you maintain that balance, if you maintain that sanctity, the calmness in your life, by maintaining that balance between your mental and physical being, then you can overcome these mental health issues. Subscribe to my channel, move on, and get more information related to mental health, physiotherapy, and do wait for more videos on this and many other topics. Thank you.